One of the very common questions I get asked about pregnancy from my pregnant patients is, what are safe positions for me to sleep in? And the answer that I give is really different than what you're going to read in your pregnancy book. It's going to be different than what you're going to see elsewhere on the internet. And that is, you can sleep any way that's comfortable. And the patient then always says, well, what about flat on my back? Because my book says I shouldn't sleep flat on my back. And the answer is the book is technically correct, but from a practical point of view, it's really safe to sleep any way that's comfortable. Let me explain that a bit. What you'll normally read is that you should sleep on your left side. That's the common thing that we like to tell patients. Well, that I don't, but that obstetricians like to tell patients, and that books like to tell patients, you should sleep on your left side. And it has to do with the anatomy of your blood vessels in relationship to the uterus. There's a big blood vessel called the vena cava, which is the vessel that returns the blood from the bottom half of the body back to the heart. And this vena cava sits underneath in the back part of your abdomen, right below your uterus. So the uterus sits on top of where the vena cava is. And the concern is that as the uterus gets bigger, it might sit on the vena cava and kink the vena cava like a garden hose so that the blood can't return from the bottom half of your body back to your heart, and it can decrease the blood flow, decrease the cardiac output, can cause blood pressure problems and cause problems for your baby in that it doesn't get enough blood flow to get the nutrition and the oxygen that it needs. So that's the worry, and that's the reason that the books will tell you not to sleep flat on your back. But why on your left side? Well, it just so happens that the vena cava is actually just a little bit to the right side of midline rather than right on the midline itself. So it sits just a little bit on the right side of your body. And so if you think about the tilt that you need to move the uterus off the vena cava, you need to tilt less to your left than you do to your right to keep the uterus off of this blood vessel. Now, why do I tell people it's okay to sleep on their back? And the reason is, think about what would happen to you if you were in a situation where the uterus was occluding or kinking that blood vessel and keeping the blood flow back. What would happen is you would wake up and you'd have this terrible claustrophobic feeling. You would have this uncontrollable urge to move in such a way that you return the blood flow back to your body. And you get this feeling way before you cause any problems to the baby. So any normal person who's laying in a position where it's knocking off half of their blood return to their heart is going to feel terrible, and everything in their being is going to tell them to move in a way that's going to return the blood flow. And again, this happens before any damage happens to the baby. However, if you're under anesthesia, for example, let's say that we're going to do a surgery, a C-section, or you're going to get your appendix out or something like that. Now that's a different situation. In that situation, we always tilt people to the left because we've taken away your body's ability to complain about the blood flow being cut off. And so if you're in a situation where that mechanism has been removed, for instance, general anesthesia, or let's say that you are knocked unconscious in an auto accident, that's a situation where you need to be on your left side. Or let's say, and you should never do this, but let's say that you get totally drunk and you pass out, or you get really high on drugs, that can take away your body's ability to have this feeling and can be very dangerous. But for general people in normal situations, there's already a built-in mechanism in your body to keep you from hurting your baby by lying flat on your back. So for most women, as they get farther along and the uterus gets bigger, it's not going to be comfortable to lie flat on your back because eventually it's going to cause blood flow problems. And so that's why I tell you to sleep any way that you're comfortable. However, if you find that that's a comfortable position, then it's a safe position. Or let's say that you fall asleep on your left side like a good person and you wake up flat on your back and you feel fine. Don't think, oh my God, I'm flat on my back, I've hurt my baby, because you haven't, your baby's fine. So again, the book, when they tell you to sleep on your left side and not to sleep flat on your back, are technically correct, but practically incorrect. It's perfectly safe for you to sleep however you're comfortable.